following is based on a true story. Only the patient name has been changed. On Wednesday, July 22nd at 4 p.m., Mary was biking home from university when she hit a deep hole trying to pass pedestrians and flew over her handlebars, resulting in a terrible accident. She was knocked unconscious and bleeding from her mouth, chin, chest, and head. An ambulance was not available, so a bystander walked Mary, who was disoriented and in shock, to the hospital emergency department to receive help. Mary waited in emergency for 1 hour to get a bed, and then another 6 hours to see a doctor. A CT scan revealed her jaw was broken in 2 places. 3 of her teeth were lost, and several severely displaced, and her right arm was broken. Mary was discharged from emergency at 1:30 in the morning on Thursday with only a diagnosis. Why didn't she receive care? Mary needed to see an orthopedic surgeon, a plastic surgeon, and an orthodontic surgeon. It became the responsibility of Mary and her family to coordinate the activities of the surgeons as it related to her care. Later that day, Mary went to a second hospital to visit the plastic surgeon. However, the plastic surgeon wouldn't look at Mary until the orthodontic surgeon looked at her first. So, Mary went to the mall with a broken arm, jaw, and teeth to see the orthodontic surgeon. The orthodontic surgeon sent her to a dentist. On Friday, the dentist fixed braces on Mary and sent her back to the orthodontic surgeon, who then wired her jaw shut. As a result, the plastic surgeon could no longer operate. On Saturday, 4 days after the accident, Mary was admitted to hospital to have her arm operated on. But she was directed to the wrong floor. This made her late for her scheduled surgery, and the surgeon moved on to another appointment. While waiting for her surgery, although Mary had given her medical history 5 times, the anesthetist was not aware that Mary's jaw was wired shut, which cost the anesthetist and the surgeon time. The surgical team explained that Mary should have had all 3 of her surgeries at once. 1 hour after her surgery, Mary was asked to leave her hospital bed to make room for another emergency and was discharged and sent home. Mary contacted her surgeon for a consult. However, he was not available, so she made an appointment with her family doctor to answer her questions. To mend Mary, it took 11 surgeons to consult and/or operate, 8 visits to the hospital, 4 days of waiting, 3 bouts of anesthetic, 2 visits to the family doctor, and several follow-up visits. Mary is on the road to recovery. By providing her story, she hopes to accelerate improvements in healthcare. This course introduces the concepts of lean, a philosophy and set of strategies and tools that have proven to be very effective in bringing about positive changes in the practice of healthcare. Once you understand the philosophy and the approach, you will be ready to proceed on your lean journey. This module describes the advantages enjoyed by organizations that choose to focus on applying lean principles to their procedures and processes. Topics include understanding value from the perspective of the patient or client, how lean originated and how it is being applied to healthcare, the magnitude of performance improvement possible, the impacts on costs and budgets, some of the challenges in implementing lean in organizations. Like any other industry, healthcare faces enormous pressures and challenges. For some time, the cost of healthcare services has been growing at approximately twice the inflation rate. To be successful and to meet growing demands of patients, clients, and other stakeholders, we must be prepared to change some of our current ideas and practices. If you are buying a product or service for yourself, what is the first thing you look for? Click on an appropriate answer. Price, on-time delivery, quality, service. That is difficult to answer without a specific product or service in mind. you look for value. Whether you are buying a $40,000 car or a week's supply of vegetables, the price, availability, quality, and service all have a place in your decision making. Our patients and clients use the same kind of decision making as you do. Patients and clients expect the best possible balance of price, availability, quality, and service. They expect top value. We need to adopt a truly patient, family-centered approach to the care that we provide. But in order to maximize the value we provide to our client, we must first understand what value means to them. Lean is both a simple strategy that focuses on the elimination of wastes, variation, and work imbalance so that each step in the process creates value for the customer, and a philosophy that allows us to properly align our processes and provide an environment in which people can be successful. Lean practices in industry have had remarkable impact in adding value for clients. Many early concepts were developed in Japan, where conditions during the second half of the 20th century demanded a new approach. That is the reason why many terms used in lean environments, kaizen, kanban, and hijunka, for example, have Japanese names. The term lean was coined in 1988 and is now widely used to describe the philosophy, the strategies, and the tools used to maximize value for clients. In recent expert testimony to the U.S. Congress, it was noted that of the $2.5 trillion spent on healthcare, a significant percentage did not add value for patients. What do you expect the percentage of non-value added expense was? A. 7 to 10%. B. 15 to 25%. C. 30 to 50%. D. 55 to 75%. Yes, the reported non-value added expense was 30 to 50% of the total spent, which translates to up to $1.25 trillion that was not contributing to patient well-being. If this figure is correct, there is huge opportunity for improvement. It has been said that only 10 to 15% of the total number of process steps in a typical organization are value added. If that is the case, then 85 to 90% of process steps are waste. Gains in the manufacturing sector through the application of lean principles are common and well documented. For example, Tyco Healthcare in Gananoque, Ontario, reduced process lead time from 17 to 3 days for one product line. With the addition of one-piece flow, they achieved 25% reduction in floor space. Their overall objective was to increase capacity by 25% over a 12-month period. This scorecard shows the initial conditions. How many cases would they have to produce per shift to meet their objective of increasing capacity by 25%? A. 85, but at lower cost. B. 100. C. 107. D. Right. To meet their objective, they needed to increase to 107 cases per shift, but their actual increase was to 130 cases, a whopping 52% increase. The chart shows they not only met their goal, but they clearly exceeded it by more than 2 times. At the same time as capacity went up, process time, lead time, product travel, floor space, and process steps were all reduced. These results might seem fantastic, but they are typical of what can be achieved. Furthermore, organizations on the lean journey understand that continual improvement is possible and set even higher targets for coming years. But this is manufacturing, even if a healthcare product. Can these kinds of results be obtained in patient care? Healthcare organizations have reported reductions of 25 to 30% in labor cost per test, 25 to 40% in patient ER wait times, 50% in hematology turnaround time. Improved processes help us achieve the lean goal of providing an environment in which people can be successful. One lab reported, "We have eliminated almost 90% of our rework and can go for days without a page from nurses or doctors. So, without all the rework, 90% of the stress level of our job has been eliminated." How are costs affected? Lean initiatives typically result in dramatically reduced costs for the same level of product or service. It becomes possible to improve both quality and quantity of service without negatively affecting the budget. Producing more with the same or fewer resources reduces the cost base, making quality healthcare more affordable for everyone. Freeing up capacity allows you to reduce wait times without overtaxing staff or facilities. Lean requires substantial capital expenditures to get started. True or false? You are correct. It is a common misconception that Lean typically requires large capital expenditure for automation equipment, facilities construction, and IT support. Lean is often a low capital cost solution. Many changes are made with only modest or no expenditures. For example, East Kootenay Regional Hospital Lab in British Columbia was faced with a space shortage. Unable to obtain funding for much-needed expansion, they turned to Lean with dramatic results. In just 16 weeks and at small capital cost, the project dramatically improved workflow and reduced collect-to-receipt turnaround time, TAT, by 47%. In a major hospital emergency department, there was a large variation in how different team members conducted their assessment, testing, care, and treatment. Impacts included unacceptable patient wait times for initial assessment, unnecessary patient stress and dissatisfaction, unnecessary staff stress and frustration, emergency rooms filled with patients waiting to be moved, emergency room nurses having to provide hospital floor nursing care. The team believed that they had a unique set of problems and that there was just too much variation in their work to apply any standard methods or lean concepts to help them. Do you think they are unique? Yes or no? You are right. They are not unique, either in having a large variation of tasks or in thinking they are unique. But once the team became engaged, they carried out a major Kaizen, change event. Their goal was development of standard practices to reduce patient wait time and to provide optimum care. The result? A 25 to 40% reduction in patient wait time. With benefits of this magnitude, why isn't every organization lean? A part of the problem stems from the belief that situations are unique and intractable. Everyone has to be convinced to get on side. Management has to provide the necessary support. Implementing lean involves learning new techniques, putting processes into action, and following a new culture or belief system. It takes focus and commitment to create a lean culture that can be sustained. Click on each of the statements and then on the matching word. Lean requires that everyone learn new tools and techniques, develop new processes and follow new procedures, question the perception of what has value and how to measure it. Action, culture, belief system, knowledge. There are many tools and components that will help you as you are implementing lean. On your journey, remember that each component contains only part of the answer. When the components are combined into an interrelated system that everyone learns and puts into continuous practice, you are developing a lean culture. You have completed this section. When an organization does not identify and use a person's potential, hands, head, and heart, on the job, this results in the waste of underutilizing people's skills. Wasting people's ideas or talents costs time and money, whereas staff engagement leads to increased staff satisfaction. Organizations that open up communications can experience the powerful advantage of real breakthrough thinking. In lean organizations, where do most of the ideas for improving process come from? A. Management. B. Quality department and other support groups. C. Outside consultants. D. Staff. Right. Staff work every day in the areas we are often trying to improve, so it should be obvious to all that it is critical to engage them in any improvement activities. Consultants, management, quality, and other support groups should be working to actively support people who do the job on a day-to-day basis. If employees are not properly trained or if they are given unnecessary tasks, their time is literally being wasted instead of being directed toward adding value to the organization. Staff who receive full training for their job requirements know that the organization believes in their ability to perform well. This raises their self-esteem, and they, in turn, are more careful, more productive, and more likely to contribute to process improvement. The organization must have a process to truly acknowledge and evaluate any given suggestion, no matter the source. When nurses and aides see suggestions being implemented, they will come forward with additional ideas. This is the foundation of Kaizen. Participative problem-solving forums of any kind indicate a culture where employees are invited to contribute ideas and wisdom to continuous improvement. Waste of reprioritization results when there is a disruption of scheduled or planned work. Which case exemplifies this waste? A. A code is called on the hospital intercom system. B. You receive a message requesting that you attend an unscheduled meeting in 1 hour to discuss process improvements. C. Housekeeping is redirected to immediately clean a recently vacated room. The next patient is already waiting in the hallway. Just because the topic is important does not mean that it should have priority over scheduled events. Even occasional schedule changes prevent us from accomplishing planned goals, and this easily becomes habitual. Some reprioritizing is required, but all reprioritizing creates disruptions. Disruptions of any kind result in extra cost, time, and potential for errors. The mere act of changing tasks costs the time to switch gears. Therefore, it is important to distinguish between unnecessary disruptions and those that might be an essential part of your duties. As you continue your journey in lean practices, you will increasingly see what was previously invisible. We can use this list to help locate wastes: overproduction, inventory, transport, conveyance, waiting, motion, rework, overprocessing, underutilizing people's skills, changing priorities. More important than naming the waste is recognizing that a waste exists and focusing on finding the underlying root cause instead of eternally treating the symptoms. This often means shedding old ways of thinking and, in effect, changing our paradigm. You have completed this section. This module compares some of the fundamental attitudes and metrics of lean organizations with those of traditional organizations and identifies some of the obstacles to transformation. Lean systems eliminate wastes and focus on value. Through process redesign and self-managing systems, lean organizations use less of everything. We need to rethink how to make each part of our organization add client or patient value, including scheduling and waitlisting, testing and reporting, admissions and registration, discharge planning, relationships with patients, internal customers and suppliers, material, service and patient flow, information sharing and information flow, facility layout and treatment availability. Of course, finding waste is the simpler part. Knowing how to remove it is the real challenge. There are 5 guiding principles in Lean. 1. Identify value from a customer perspective. 2. Map the flow of product or service. 3. Make the product or service flow. 4. Create pull based on customer demand. 5. Continually find ways to improve. To rethink how to make each part of our operation add customer value requires that we also look at our assumptions and conventional wisdom relating to the best way to do things. In Module 1, we said that Lean requires us all to question our perception of what has value and how that value is measured. This can be seen as a change in culture or a change in our belief system. This means changing the way we talk to ourselves and to others. Rather than saying, we have to do it that way because, we start to ask, why do we do it that way? And then, how can we do it differently so that it increases value to the client? Once we define those things that are of value, we can start to identify the items that are not increasing value. We can start to see waste. You will notice that one waste often leads to another. For example, overproduction can result in work in process, which is a form of inventory. Moving inventory to and from storage adds no value, while it does incur cost. This is waste of transportation. Unnecessary transportation can result in waste of waiting. Many of the wastes found within organizations result from a failure in communication. When processing steps cross over departmental lines or are separated by distance, look for communications breakdown. Recall Mary's 5 histories? What about the case of forms that admissions created and day surgery filed because each department thought the other required them? Which long-term goal would probably be more successful in preventing wastes that result from failure to share information? A. Fully automating the records. B. Adding new staff to focus on communication. It all depends. Fully automating the records might solve some problems, but it is a complex issue with many considerations, including patient privacy, access where and when needed, control, and validation of information. If we are keeping information no one uses, like the day surgery forms, automating it makes no sense. At the same time, adding staff to phone, email, or otherwise communicate upstream and downstream is simply creating another process step. The problem might be reduced, but it is unlikely to disappear. The fundamental issue is that we have to think out of the box and neither accept bad situations as inevitable nor jump to conclusions about the best way to solve problems without proper analysis. For some, conventional wisdom says, if it were all just computerized. For others, conventional wisdom says, if we have a problem, add more staff. Conventional wisdom is not that helpful in solving problems in the complex healthcare system. But when problems arise, we tend to rely on conventional wisdom. We all have a set of beliefs about how things work and how they should work that can get in the way of removing wastes and adding value for the client. In the rest of this section, we will look at several beliefs that can influence our thinking about problems and solutions. If patients are waiting for access to diagnostic or treatment equipment, would getting a faster machine be the best solution? Yes or no? Correct. Often a smaller, more nimble machine is actually better. For example, the use of portable X-ray diagnostic units that can be rolled right into emergency has substantially reduced assessment time in some hospitals. Conventional wisdom tends to be that bigger and faster machines are better and will automatically increase throughput. If you are selling the machines, that wisdom serves you well. Understanding patient demand is critical in a lean organization. Once understood, then a number of lean tools and practices can be engaged to optimize the equipment utilization to match the patient demand. Purchasing additional or faster equipment is a last resort and might not solve the problem. For example, in some cases, the times that a clinic or diagnostic testing facility is open do not coincide with patient flow, creating backup and delays. In a lab environment, machines should be grouped in such a way that facilitates flow and reduces unnecessary operator movement. These before and after photos of a lab in East Kootenay Regional Hospital Laboratory show the results of a concerted lean drive. TAT times on all major lab tests were substantially reduced over a 16-week implementation period. For example, the percentage of INR results delivered before 0800 went from under 30% to over 80%. But in another lab environment, staff breaks coincided with the highest receipt of specimens, leading to subsequent delays. There are often scheduling, overproduction, or overprocessing issues, internal turnover delays, and even process availability that can limit equipment utilization. Thinking lean also means changing attitudes toward duplication of effort and rework. In a lean organization, an acceptable objective is to keep the rework at less than or equal to A. 15%. A truly lean organization would set the objective lower. A truly lean organization. Yes, quality is built in at every stage. Staff catch defects at the source, and processes and procedures are adjusted so that the product or service is correct the first time. Which statement best characterizes a lean organization? A. Two-way communication flow openly highlights patient issues, delays, rework errors, and abnormalities. B. Management focuses on each staff member, optimizing his or her tasks and use of time. No. In a traditional organization, management controls all of the information, and communication is limited. Staff are strictly task-oriented. Lean organizations ask for input from everyone to solve problems and improve efficiency. Try again. Yes, communication is the foundation for success. Every problem that is identified presents an opportunity for improvement. Information and communication lead to mistake-proofing processes to prevent future breakdowns and to eliminating duplication of effort. The staff is engaged to help solve problems and look at new ways to do things, while the management team supports and enables the changes to occur. Staff still perform their assigned tasks, but they also are encouraged to continuously find opportunities and volunteer for actions that lead to general or specific improvements. Everyone is encouraged to practice a go and see approach, where the focus is on understanding what is really happening at that time and place. Traditional managers tend to manage day to day, based on standard financial cost accounting and reporting. Focus is on departmental efficiency, total number of tests performed, labor cost by function, unit costs for supplies. Goals are then established for each of these functions. Typically, traditional practice consists of managing the difference between goals and actuals. A problem with traditional measures as management tools is that they often focus on single functions without consideration of the whole system. Lean organizations introduce process measures to drive the desired actions and behaviors that support the end-to-end flow of work throughout the patient value stream. By focusing on the flow of patients and the activities that generate value for the client, lean measures drive process changes toward the desired future state of the organization. Some typical lean measures include takt time, turnaround time, wait time, changeover turnover time, space utilized, distance traveled, batch lot size, defect rework percentage. Traditional measures tend to be long-term and accounting-oriented. Lean measures are generally short-term, process-related, and patient or client-focused. If we introduce new process-related measures, do we still need traditional measures? Yes or no? True. For reporting purposes, traditional measures are still needed and useful. Lean measures are needed to allow us to improve the entire end-to-end patient care delivery system. They are process-based and reinforce the right behaviors. Because traditional measures are firmly rooted in our culture, it can take some time to reorient everyone to lean measures. Traditional and lean measures need to coexist, but only the lean measures should be used to drive day-to-day decision-making. You have completed this section. This module describes lean as a process and philosophy and highlights some of the barriers to implementing lean. It lists some of the lean tools in the toolset, emphasizes the need to develop a new approach, and provides some ideas on the time necessary to transition an organization from traditional operations to lean operations at a world-class level. In Module 1, we learned that lean is a simple strategy that focuses on the elimination of wastes, variation, and work imbalance. It is also a philosophy that allows us to properly align our processes and provide an environment in which people can be successful. Implementing lean involves learning new techniques, putting processes into action, and following a new culture or belief system. And implementing lean takes focus and commitment to create a lean culture that can be sustained. Because lean requires new processes, measures, and ways of looking at our organization, transition can require overcoming considerable barriers. Lean isn't for the faint of heart. The leadership, both medical and administrative, as well as staff, must embrace a patient, family-centric model and commit to delivering patient value. Experience has demonstrated that the most committed teams generate the best results, even where a greater need or opportunity exists elsewhere in the organization. You might have heard objections like these. We are different. This isn't manufacturing. We are too complex. We are dealing with people's lives. We don't need it here. The doctors will never support it. We're already working too hard. It's not our fault. Yet there is growing evidence that properly implemented lean techniques can substantially improve quality, speed of service, and overall value for healthcare clients. Lean starts with recognizing that delivery of care is a complex system of many interrelated processes. Each part and subsystem contributes to the overall performance of the system, just as the circulation system contributes to the overall performance of the body. Overall performance is directly linked to how well these processes work together. A manager recently returned from a healthcare conference on lean. She has decided to try some kaizens, improvement activities, in your department. Will kaizens make you lean? Yes or no? Good. You need a plan that takes into account the interactions of your department with other departments and the impacts of change on the whole system. This is driven by a true focus on value from the patient-client perspective. We say that healthcare is a system. The word system is frequently used in discussions, but do we have a common understanding of what we mean by a system? Can you write a good definition? Yes or no? By a system, We mean that the parts and processes are arranged to completely mesh with each other, to add value to each other, and to function as a whole. Systems have many interrelationships, complex mechanisms, and complex communications pathways. For example, the human body has many subsystems involving specific mechanisms, such as the heart or liver, transport subsystems that move nutrients, and complex communications subsystems to manage all of the chemical and biological processes. What happens if a part of this system is broken? A. The system stops working correctly. B. The system continues to do a good job. Depending on the part that is broken, the human body system might continue to function in some capacity, but the result is far from the ideal. In treatment, we are aware of the complex reactions that occur within the system, so we treat the whole patient. We try to manage the entire set of complex processes and communications. In a transplant, for example, we deal with pain management, rejection suppression, possibly diet, and other issues of general well-being. Just as the human body is a complex system, healthcare is also a complex system, with many interrelationships, complex mechanisms, and complex communications pathways. And healthcare organizations include people, with all of the added complexity that this implies. Unfortunately, organizations often tamper with processes in isolation. Things still work in spite of this, but at a greater cost and effort, and with less effective delivery of patient care. In a lean system, the components, including the people and the processes, are optimized from end to maximize value for the customer. In healthcare, implementing lean means optimizing the end-to-end system to meet patient and client needs, not just trying to optimize some of the parts. It also means focusing on finding the root cause rather than just treating the symptoms of a problem. If a patient came into emergency complaining of sudden severe headache, you would not typically just give a painkiller and send the patient home. Rather, you try to find the root cause of the pain. Similarly, if you have a problem with errors occurring in procedures, you do not just treat the symptoms. You try to find the source of the errors. For example, in discussing his 2010 book, Operating Room Confidential with Maclean's Magazine, Dr. Paul Wang described potential mistakes leading to death in anesthesia. From around 1 in 10,000 in the 1970s, this has been reduced to around 1 in 200,000. One root cause for error was lack of standardization of machines. In some machines, turning the control knob clockwise would increase the flow of vapor. In other machines, this would decrease the flow. Understanding the root cause led to machine standardization, thus completely removing this source of error. There are many tools in the Lean Toolbox. Knowing them and using them correctly is critical. Some of the more common tools that you might use are Enterprise Value Stream Mapping, A3 Reports, Root Cause Analysis, 5S Workplace Organization, Standard Work, Mistake Proofing and Six Sigma, Flow Work Cells, Hajonka, Kanban Supermarkets, Quick Changeover Turnover, Kaizen Events. How many of these lean tools do you recognize and understand? A. Fewer than 4. B. 5 to 9. C. 10 or more. Knowing some of the tools that are available is a good start. But you need much more than a set of lean tools to go lean and stay lean. Your organization must have a single-minded focus on continuously improving transformations, which add value. and on reducing or totally eliminating incidental or purely wasteful work that adds unnecessary cost but is of no value to the client or patient. It is a system-wide focus on continuously improving transformations and eliminating transactions that defines a lean organization. This can require that we look at processes and problems in a whole new way. Implementing lean requires strategic thinking and a future state value stream map, plus a future state implementation plan to implement the lean changes and achieve the lean results. How long do you think most organizations take to go from traditional to lean? A. 6 months. B. 2 years. C. 3 to 5 years. Organizations that are just starting on the road to lean can expect to take 3 to 5 years to begin to approach world-class lean operations. You expect to see fairly immediate improvements, but you are never finished with adding value. The long-term view is that of never-ending lean implementation and improvement, part of a vision of value-added patient products and services that are forever improving. Lean organizations are on a never-ending journey. This journey of improvement begins with a current state map, a future state map, and a 3 to 6 month implementation plan, dependent on an organization's ability to provide the necessary resources to support the kaizens, or changes. Why do we promote a short 3 to 6 month implementation timeframe? A. To encourage action. B. To challenge ourselves. C. To use existing equipment and other resources. D. To tie change to existing goals, objectives, and operating plans. E. To promote widespread staff engagement. F. All of the above. Yes, these are all good reasons to promote a short 3 to 6 month implementation time frame. Planning, challenging, and taking meaningful and effective action promotes widespread staff engagement. This, in turn, begins to develop the culture of lean that will nurture and sustain the initiative. Each cycle of change attempts to move you from your current state to the desired future state. This future state then becomes your new current state, so that the cycle of continuous improvement is maintained for the life of the organization. You have completed this section.